Hello, everyone, and welcome. Thank you all so much for joining us today. My name is Ariana Ali, and I'm a second-year medical student at the George Washington University School of Medicine and Health Sciences in Washington, D.C. I'm also one of the student leaders at our local SAFE chapter. I'm looking forward to this event as we talk to Dr. Cedric Dark, an assistant professor at the Henry J. N. Taub Department of Emergency Medicine at Baylor College of Medicine. The format of our event this evening will be a guided question and answer session with Dr. Dark, who recently wrote Under the Gun, an ER doctor's cure for America's gun epidemic. We have some questions lined up, but we would also like to give our audience the opportunity to submit some questions in the chat, which our moderator will keep an eye on and line up for us. And if you haven't read the book, we encourage you to order a copy directly from the publisher, and the link for that will be in the chat. One of the things from Dr. Dark's book that I took to heart was his encouragement in sharing our own stories in firearm injury work. Stories are really critical so that the overwhelming statistics don't just numb us over and over again. Stories are also a way to connect and a way to remind us of why we're here on a Tuesday evening when there are a lot of other things that we could all be doing tonight. Telling our stories also helps us to be better advocates for ourselves and for our patients. In that vein, I'd also like to share how I became involved in important gun violence prevention work as a survivor myself. On February 14th, 2018, there was a shooting at my high school, Marjorie Stoneman Douglas in Parkland, Florida, in which 17 people died and 17 people were injured. After witnessing this tragedy firsthand, I began working in gun violence prevention myself, along with my peers. And through this work, I met so many survivors across the nation, as well as advocates from different lines of work. I saw many physicians in particular in the years following, doctors like Dr. Dark stand up and fight for gun violence prevention, and that ultimately inspired me to pursue medicine myself, and now I'm an aspiring pediatrician. So I'll now ask my co-host Megan to introduce herself.
Hello, my name is Meagan Mitchell. I'm also a second-year medical student at GW. And before we get started, I would just like to ask everyone to find their mute button and to keep themselves on mute to eliminate any background noise and distractions. I became involved in this work when my interest in medicine, in particular trauma surgery, took me to GW's emergency department this past summer, and I saw firsthand the impact that gun violence has on Washington, D.C. As a future surgeon, I hope to not only become skilled in treating those infected by gun violence, but more importantly, advocate for measures to prevent those patients from arriving in our emergency department in the first place. So after these experiences sparked my interest, getting involved with SAFE was an easy decision. SAFE is dedicated to eliminating the firearm epidemic through research, education, and evidence-based policy. SAFE is a nonprofit organization whose members are U.S. medical students, physicians, nurses, researchers, and healthcare professionals. It is led by 12 board members and one staff member who's with us tonight, our executive director, Allison Volkman. And now to why we are here.
Just as Megan and I are beginning our training at GW, Dr. Dark completed his residency training at George Washington University, where he served as chief resident. He also holds a master's in public health from the Mailman School of Public Health at Columbia University. In his book, he talks about the beginning of his journey in the important work of gun violence prevention. After a 2018 comment by the NRA suggesting that doctors should stay in their lane regarding firearm violence, he was one of the co-authors of a response titled "This is Our Lane," which became a rallying cry for healthcare providers to speak out about this epidemic and sparked a grassroots movement, amplifying the voices of those on the front lines and reframing gun violence as a critical public health issue. Dr. Dark, thank you so much for agreeing to join us this evening for one of SAFE's 2 national events a year. My first question is, why do you feel so compelled in that moment after NRA Stay in Your Lane comment to advocate for healthcare providers to speak up on the issue of gun violence?
First of all, I would have to say I don't like being told what to do. So that's probably one thing, and I especially don't like being told what to do by people that really have no business telling me what to do. So that's one of the major reasons why I got involved at that particular moment in time. And again, this is something that kind of been brewing that year. And Ariana, you mentioned it with the Parkland shooting. It happened earlier in that year in February. And one of the things that I personally did at that point in time, I had owned stock in a Sturm Weber, which is a firearms manufacturer, as part of my retirement portfolio. And I fully divested from that after the shooting at Parkland. So that was just one minor little change that I made personally that year. The NRA kind of tipped it over the edge a little bit with their comment. And then a couple weeks after that, there was a shooting at a hospital in Chicago, and an emergency physician by the name of Tamara O'Neill was shot and killed, maybe about 2 weeks after the NRA tweet. And I think that just added fuel to the fire for those of us that work in this space, that are impacted by it personally, and that are just tired of seeing people get shot and killed.
Thank you. It's interesting to see the connection of both your and Ariana's advocacy and what brought you into this line of work. So long before writing This Is Our Lane, This Is Our Lane response, in graduating from college and earning your medical degree at NYU, what led you to pursue emergency medicine as your specialty?
So emergency medicine for me wasn't really a thing initially. I don't think I knew too much about it. Like you, I wanted to be a surgeon. So hopefully I still have time to convert you out of surgery and into EM. But for me, when I first got to medical school, 2 weeks after I got to med school at NYU was 9/11. And that was one of those events where immediately as a 2-week-old medical student, we're trying to figure out what could be done to help save people's lives, or to jump in a crisis. And not much was able to be done, but people from our class and from the rest of the school tried to get involved at that point in time. And that was our first year of medical school. In our third year, when we got on the wards, there was this other event that took place that summer. There's this blackout in pretty much like a large area of the Northeast. And they needed a lot of medical students to help volunteer in the emergency department because nurses couldn't necessarily get in through the subways. It was essentially electricity was out for a few days. And I remember volunteering there at the time. And every time thereafter, when I hit my clinical rotations, I just felt more and more at home in the emergency department. It provides a nice situation where you can intervene and help people immediately. I was never a huge person on requiring continuity of care. So that really wasn't something that made me, have to be like a primary care doctor or someone in a primary care field. And then I think it also provided a lot of flexibility for doing other things that I enjoy doing, like advocacy and health policy, because of the lifestyle of emergency medicine. So those are probably some of the reasons that made me go into EM.
Thank you for sharing. I think it's really interesting how events kind of shape like what you pursue going forward. I know like what I went through also like pushed me to pursue medicine um and advocacy. So after completing your training and before writing the editorial This Is Our Lane response, what drove your concern about gun violence?
Well, what I had been doing since residency, I had been focused on what I like to call evidence-based health policy. And I had started a blog back in 2008 in the middle of my residency program called Policy Prescriptions. And what we essentially did, initially it was me, then it was a colleague of mine, and then we finally grew it to maybe about 24 physicians, nurses, and other healthcare professionals, is we would write quick little summaries of health services research that could make it accessible to people in the clinical fields. Because again, when you're doing residency, when you're in medicine, you're focused so much on clinical articles, reading JAM or New England Medicine or Annals of Emergency Medicine, that you don't really have time to look at things like Health Affairs or the Milbank Quarterly or other policy related journals. And so we read these things and kind of distilled it into little bite-sized snippets, almost like a Cliff's Notes for health policy. And there are a few topics. My major topic, the one thing that I really am mostly passionate about, is like increasing coverage, making sure everybody in this country has access to healthcare. But we focused on lots of different things, and gun violence prevention was one. And eventually, as we ran this blog, when I got to Baylor, I wound up having a symposium. We did this for 5 years, where we bring people together for like an afternoon for about 4 hours or so and go in depth talking about various topics, one of which happened to be firearm injury prevention. And I learned from other people that were even more expert than me about what firearm injury prevention was, but with that spin of evidence-based, what could actually be done to stop people from getting hurt or stop people from being killed? And that was sort of where my focus had always been up until the point the NRA said, the whole stay in your lane thing. And for me, policy is one aspect of the lane that I'm in, and medicine's the other aspect of the lane that I'm in. And bridging that divide is exactly what I wanted to do. And so when they put the tweet out there, they actually referenced a resource from the RAND Corporation in their Science of Gun Policy article, which it's like 400 pages long. They're on their 4th edition of it now. So I would highly recommend, if you have not looked at that, it's something worth looking through and reading sort of the summary of it. But I looked at sort of the discontinuity between what the NRA was saying in terms of gun laws and what the RAND report actually said. And there are plenty of things that we can use that can actually save people's lives. And as someone whose profession is, helping people, that's exactly what I wanted to do.
That's great. And then kind of building on that, why should, in addition to emergency medicine physicians, other specialties like venture into the lane of advocating for gun violence prevention policies and practices within their own institutions?
Yeah, I think it's the role of physicians in general. And when we think about it, I think pediatricians were largely some of the first people focused on public health and, thinking about kids wearing helmets and seatbelts and all those kinds of activities. Our primary care professions have been focused on this for a long period of time. And I think that we've seen more and more of our specialist groups start to approach medicine, not purely from the one-on-one at the bedside, but sort of from the public health aspect and how you can influence people's lives through policy. The main reason I think this impacts all of us, and I'm assuming that many people here are either in medical school or practicing as physicians. I would encourage you to go back to the father of modern pathology, Rudolf Virchow, because he's the father of social medicine. And he's the one that says, medicine is a social science and politics is nothing but medicine at a large scale. And that's one of those quotes that I've found and loved and stick with. And I keep telling to every audience that I talk to, because when we think about it, medicine is one of those things where we are supposed to get involved and we are supposed to help out our communities and not just the one person in front of us.
Thank you. There are emergency docs, though, who are avid supporters of the Second Amendment and might disagree with what you have to say. So what do you say to them?
Well, first of all, I'm a supporter of the Second Amendment as well. I'm a gun owner. And I don't buy the concept that you can't be a supporter of the Second Amendment without actually, also thinking about how we can make firearms safe for people to use. And I think one of the things that, and maybe it's one of the misconceptions about all this, and I think it's been kind of screwed up because there are the advocacy organizations like the NRA or the National Sports Shooting Foundation that are focused on the Second Amendment purely without thinking about it in context of society as a whole. But I think if you ask most gun owners that are actually like responsible human beings, they would agree that a lot of things need to be done, to make sure the right people have access to firearms and make sure the wrong people don't have access to them. And when those firearms are in the home, that they're secured from people that don't need to access them, like children, elderly people with dementia, that sort of thing. I think that there is agreement in a large amount between people that are traditionally what we would say pro gun rights and people that are pro gun safety.
Building on that, pro Second Amendment gun owning doctors aside, what about medical students or physicians who say they'd rather stick to the science and the medicine and stop being political? I know you've touched on this a bit, but maybe you could talk about how could those people who are uncomfortable with feeling that they are getting political, how would you respond to that comment?
I mean, I bet you they're political in other avenues that they just don't really pay attention to, right? And nothing is to say that you shouldn't be political. Now, I do say we shouldn't be taking our political beliefs into the exam room and trying to twist our patients' arms necessarily. I don't think that's the right way to do it. But I don't see anything wrong with us as physicians being politically involved in causes that we feel are important. We do it all the time when it comes down to reimbursement. We sit and we give money to politicians and we lobby through the AMA or through our specialty organizations to make sure we all get paid. That also is politics. So whether we're dealing with gun violence or climate change or abortion or whatever else, we still get involved. There are plenty of physicians that don't want to be, that say, on the one hand, let's not be involved in politics, yet at the same time are currently sitting in Congress dropping bills banning DEI, which again is political in nature in and of itself. So I don't believe that people that say that are being genuine. I think that they're actually just they don't like what other people are doing in terms of their politics. And I would say just be open and honest about it. Everyone should be involved in politics to a degree, but keep it outside of the examination room.
In your book, you assert that Americans own more firearms than the rest of the world's professional militaries combined. I found that really startling myself. Can you tell us more about that?
Yeah, so there's this survey called the Small Arms Survey that when I was researching for the book, I found that it said that maybe the global militaries have maybe 133 million firearms or something like that. When we think about it, we already know that there's at least one gun for every man, woman, child in this country. So that's more than 300, 400 million firearms in the US alone. So it's a stat I also found ridiculously amazing. And so therefore, I was like, I got to throw this in there because I don't think most people realize that American civilians own more guns than the militaries of the world. You know, it'd be really hard pressed for someone to try to invade this country just because we all have a bunch of handguns and AR-15s or who knows what else. I also and I say this kind of jokingly, I would argue that probably my hospital is probably the most secure site in Texas because we've done some gun lock distributions and our staff keep coming down all the time and getting lots and lots of locks. So I would imagine we're pretty well, fortified at the county hospital too.
There was a significant section of your book that was dedicated to discussing the policy solutions to gun violence. It can be overwhelming knowing there's not just one solution to this problem, but many possible policies that need to be passed or strengthened in order to reduce injuries and deaths due to guns. Can you share with the group tonight which of those policy tools out there you think are the most important to implement?
I think first and foremost, background checks are the number one thing that we need to do right now. When you think about it, only 4 out of 5 gun transactions have a background check run on it. I told you I own 3. If I wanted to sell one to each of you guys, I could do so without running a background check on you, figuring out whether or not are a domestic abuser, whether or not you're a criminal. And that would be totally legal to do such a thing. And so that's one thing, is that limiting that private person-to-person sale without a background check needs to be limited. I think another thing that's very important is looking into domestic violence restraining orders. As I mentioned at the top of the hour, I'm talking about Tamra O'Neal. The person that killed her had been had some restraining orders, and arguably there are some domestic violence issues in that situation as well. And if he had been able to be disarmed beforehand, perhaps she could still be alive. We know scientifically that that's another strategy that saves people's lives. And then lastly, I think a couple of them are trying to help reduce suicide, especially among children and teenagers. Either age greater than 21 laws or child access prevention laws, which include safe storage laws, are shown to prevent suicides in this age group. Because again, it's very difficult for children to purchase their own firearm unless they've become 18. And if we can increase that age further to 21, it would be harder if you for kids and adolescents to kill themselves. And we know now through some of the research that this is the #1 cause of death for people in that age group. So I think those are two really important laws that could be pursued, all four of which of those things are evidence-based. If you look at that RAND study, same study that the NRA threw out there to tell us to stay in our lane.
That's a really good point. I know in Florida, specifically in 2018, they actually did raise the age limit to own a handgun up to 21. But I think governor or the government right now is trying to reverse that currently. They just put in a bill for that. So, um, our next question is, what would it take for the US to pass more laws that regulate guns or ammunition?
Well, don't expect it to happen in the next 2 years. Anything done at the federal level, and I say this for any policy that you want to have happen, in this country. I have a health policy fellow that we bring into our emergency department every year, and one of the first lessons we have is just how to do the math on making something happen, right? You need 218 votes in the House of Representatives to get a law to pass or a bill to pass that. In the Senate, I would ask you, how many votes do you need to get something to pass in a 100-person Senate? It's not 51. It's really 60 because you got to surpass a filibuster for most things if you're dealing with policy. And so realistically, you have to have those 60 votes to make it happen. Then, of course, you also have to have a president willing to sign it. And so you need to have those numbers in order to get something passed at the federal level. So without that, I'm not saying that it's not worth trying, but it's very difficult unless you are in control of both of those sides of Congress and the White House to be able to make any laws take place, any laws happen that way. Now, can be some stuff happening at the regulatory level, but again, I tend to think a little bit more in terms of legal lobbying as opposed to regulatory lobbying. And so as we stand right now, the current administration has gotten rid of the White House Office of Gun Violence Prevention, which the Biden administration founded a couple years ago. And so I don't think the appetite's going to be there for anything at the federal level. And so I think really for people that are probably on this call, folks that are interested in either implementing laws or strengthening laws, I think the real impact is going to be at the federal level. And if listening to my last answer about those 4 laws that would be life-saving, if your state doesn't have those in effect already, start working on that, because I think that's one area where you can at least make things safer in your state.
Yes, so talking about how it's hard to get things done in Washington, D.C. or at the state level, can you share a little bit more about what you were just mentioning, how you could go about trying to make change at the city or local county level?
Yeah, I really think that's going to be a state by state kind of issue. Texas, I think, has done a what I would say a terrible job of preempting a lot of state and local laws. Most recently, things like COVID regulations in terms of social distancing, masking, that kind of thing. The state kind of came in and said that cities couldn't do it, and big cities like Houston, which are larger than certain states even, are essentially prevented from doing things that might improve their public health because the state said so. But if you're in a place where a municipality has that kind of right, I think there are certain things you can try. Now, the question is, how effective would it be? If you're a small town, and you put up a safe storage law, maybe you have your own police force or whatever, that might make things in your town a little safer, maybe. But when it comes to things like purchasing, if it says you have to be greater than 21 to purchase in, this town over here, but it's only a 5-minute drive to the next one, that may not actually do anything. Because again, commerce, is a little bit harder to to regulate because firearms, get trafficked so easily. One of the things I saw this past year, is that most of the guns that are used in the cartels in Mexico come straight out of Texas. We're the ones supplying a lot of this stuff. So I don't know how effective those things would be, but there probably are some areas where you can make minor impacts at the margins, and I think safe storage is one of those areas where you could probably do that.
Going off of that, in your book, you framed various responses to gun violence as being in one of three different categories of prevention: primary, secondary, or tertiary. I'm hoping you can maybe give a few examples of each type of prevention, because it might help our audience think of types of prevention work that they might be interested in focusing on.
All right. Yeah, I can do that, but I'm gonna have to put you on the spot, Ariana, a little bit. Maybe Megan, you can help out because they told me before the call that they're studying for step 1, so I know they know all they need to know about primary, secondary, and tertiary prevention, correct? Excellent. So would you mind telling the audience what primary prevention means?
Primary prevention is to prevent the disease, or I guess in this case, the injury before it happens.
Okay, right. So it's kind of like making sure stuff doesn't take place in the first place, right? So maybe changing behaviors, stopping smoking, that sort of thing. The way I think of primary prevention for like firearms is background checks, right? So we don't want people to get shot, but let's not like have people get guns in the first place. Okay. All right. What's secondary prevention?
So that would
You
be
know there was
like
a pop quiz when you were interviewing me, did you?
that would be like identifying people who have the disease or condition. So in this case, I like it would be a screening type of thing.
Exactly. You guys are really good at this. You're doing much better than the residents do when I've given this talk to residents. So yeah, so screening, right? So the way I think about it, if we look at like domestic violence restraining orders, that's like screening people that have firearms, but who's at risk for doing something, and making sure that we can sort of prevent them from using that firearm. You could also think of maybe safe storage as a secondary prevention type thing. People that already have firearms, encouraging them to lock them up. Okay, tertiary prevention. What's tertiary prevention?
Uh, I would say once the disease or injury has occurred, so I guess in this case, once an injury has occurred, so I'm thinking maybe something like a hospital-based violence intervention program.
Exactly. You don't even need me here. You got this already. And I think you're ready for your boards now, at least for the public health part of it. So yeah, that's exactly what I like to use as my example is sort of hospital-based or community-based violence intervention programs are a type of tertiary prevention. It's stopping a disease from happening a second time after it already happened, right? So you had a heart attack. Tertiary prevention is putting you on all the medicines that you need to prevent you from having that second heart attack, or in this case, once you've been shot, what can we do to prevent you from being shot again or having trauma and recidivism? So excellent. It's a great, good round of applause for you guys because that's really good.
Thank you for putting us through that review exercise. So moving on to our next question. After the school shooting in Michigan, in which a parent purchased the shooter's firearm and did not properly supervise him, what do you think of holding parents accountable for children causing mass shootings, and how do we prevent children from accessing firearms in the home?
I think this is a very difficult situation. It really gets into, again, safe storage, but also what happens when parents are negligent. And I think, I take my lead on this from one of our district attorneys here in Houston. I heard her speaking a few years ago about this, and I think one of the biggest issues is, let's say a parent has their firearm out and like a toddler picks it up and then shoots somebody, and there's this tragic death that happens. It's really hard to then go out and prosecute that parent when they're also grieving their kid, you know. Um, Even though that's what the law says to do. And I think it's a much easier situation where you say a parent left their gun out and therefore, you know, some teenager picks it up, takes it to school and shoots people. Like I think that like from a standpoint of law and order, and the police, it makes a whole lot more sense to prosecute that one versus the other one, when in reality, both of them violated whatever law, safe storage law there is at that point. And so I think that this is where it's difficult. I don't have a great answer for it. I think what District Attorney Ogg sort of said was that she encouraged the police to bring every single one of those cases to her and let the lawyers figure it out, as opposed to the police kind of shutting some of these down before they could even get into the process. Maybe that's the right way to go about it. I don't know personally, but I think it's something as a society that we do need to start considering. And I'm personally happy to see that when someone commits a heinous act that's intentional, that, you know, the parents have some kind of culpability for it.
I think we have two chat questions we could possibly address now, kind of related to having a firearm in the home. Someone asked how, like, what led you to gun ownership, and like some others maybe can't imagine owning a gun, so it'd be helpful to hear your perspective if you're comfortable sharing.
Yeah, so back in 2014, I got home from a shift and walked into my house, and I noticed like the lights were on and there were some cabinets that were open, and then I quickly realized after taking a couple steps in that my house had been broken into. So I walked outside because I didn't know if like whoever was in there was still in there or not, and then we waited for the police to clear the house. The next day, my wife, she's the native Texan, went to Academy, which is like a sporting goods store here, and went out and bought like a shotgun and a pistol, and therefore I became a gun owner. Like literally the next day, because it does not take long to buy a gun in this country. But for me, like the next step was like, okay, now I have this deadly weapon in my house. How do I use it and make sure I don't shoot myself? Number one. And then later on, you know, when we had a kid, then it is like, well, at some point I probably need to like make sure this thing is not going to harm him as well. And so we got like a safe, and like gun locks to use, that sort of thing. Because prior to that, we hadn't really locked it up so much when it was just two adults living in a house. But definitely when they have kids, I think that calculus changes a little, at least for me, it changed a little in terms of how I store things.
Thank you for sharing. I know it probably gives you good perspective being a gun owner yourself. It's not, you have a little bit more insight when you're telling people about these issues. And then along the lines of, we were talking about secondary prevention with screening, several people were asking what you think about discussing safe firearm storage with patients, and like if and how physicians should be doing this.
Yeah, that's one of those things I think we're starting to see a little bit more in terms of educational materials in that front. I know our students have been asking for this at Baylor, and quite frankly, I'll plug one of our medical students, Amelia, who just had something published in like JAMA Network Open, I think, like this week on storage issues. So make sure everyone go read that. But I think the difficult part is most of us are not taught how to do this or have these conversations, and I think that's where the gap is in terms of how to have those conversations. I, for one, was never given those. The one conversation that I do have is usually in the context of an emergency room visit, someone that's there for suicidality. And I think the extent of it is, do you have a firearm or not? Because if they do, that sort of, in my mind, changes their risk profile than someone that doesn't, because of the lethality of firearms. And, you know, I've seen our psychiatrists call collateral in order to make sure that the firearms are taken away from the person before they would even consider releasing them back home if they decided that they don't need inpatient hospitalization. In terms of the storage question, I personally feel like that's something I would punt to primary care doctors, because I feel like they already go through all these other safety questions Do your kids wear bike helmets, or did you get your colonoscopy? Did you get your flu shot? I think that's a perfect time to just ask them, hey, do you have firearms at home? And if the answer is yes, are they stored securely? That sort of thing. I think that's the way I would approach it. But for someone in the ER, it's not a relevant question for me to ask every single patient.
Great, thank you for responding to those questions. And then a quick question for you, going back to holding people accountable for shootings. I'm wondering if it's possible to hold gun manufacturers accountable for the deaths of over 48,000 Americans each year.
Yeah, unfortunately, not really. There was a law passed, I forget the name of it, but it's like the Protection of Commerce and Firearms Act or something like that, where essentially Congress decided that firearms companies could not be prosecuted or sued for damage from their products, from their consumer products. And that's something that's been very difficult for anyone to bring a suit. Now, what's interesting right now, the country of Mexico has actually brought suit against manufacturers, and that's working its way through the court system right now. And I think it'll be very interesting to figure out whether or not Mexico's liable, or Mexico's able to cash in on that liability, because I think it prohibits US citizens from bringing that. But I guess the question is, can other countries bring it? And especially since, as I said before, a lot of those weapons are being funneled from the US down into Mexico. We'll see where that goes.
So the next question is, what do you mean when you say gun violence, rather than being an epidemic, is endemic to America?
Okay, so this is since this is a more of a, if I were going to ask you guys the question, ask or figure out what I'm thinking kind of question, I won't actually ask it of you. But when it comes down to sort of the definition of epidemic and the definition of endemic, so an epidemic usually means, you get like a burst of, let's say, an infection or some kind of condition that goes up, and then eventually comes back down. Kind of, if we think about the initial waves of COVID, right? Or even right now, measles, we're having little measles outbreaks. And so you'll see a little burst where it'll go up and then it'll come back down. We haven't really seen that in terms of like firearm violence. We just see sort of a steady increase over time. And I think what that tells me is it's more of like an endemic disease. So like malaria in sub-Saharan Africa, it's not an epidemic per se. It's there, it exists. And it's going to be kind of hard for us to get rid of it. And so I think we just need to think about it in a different sense. And the reason why I say this is because, language means a lot to people, and some people have thought when we use these public health terms like an epidemic, then maybe they're like, well, it's going to come through and it'll burn out on its own, that sort of thing. And maybe we don't really have to intervene on it. Maybe there's nothing that we can do about it. Whereas I think that the reason I choose endemic, if I'm being like technical about it, is I think that in order to make any meaningful impact, we're going to have to put in even more measures than we otherwise would. Because most little epidemic outbreaks kind of pop up and they fizzle over time.
Following up on another public health analogy used in the book of the mosquito vector, can you talk about how you applied that to gun violence?
Yeah, so I love to tell people like and have them guess like what's the deadliest animal on the planet, because inevitably someone's going to say humans, which is not true. People might think of like sharks and alligators or snakes, also not true. The deadliest animal on the planet is the mosquito, right? But it's really not the mosquito that's killing people. It's Plasmodium or dengue or whatever, vector-borne illness the mosquito carries. And I think of guns and bullets the same way. This is one area where I actually will agree with the NRA. And what they say is that guns don't kill people, people kill people. Because the gun is just a vector, in transmitting whatever this, disease agent is. That disease agent may be things like hatred, depression, suicidality, misogyny, racism, all that kind of stuff. And I think that's where I personally start to think about sort of the cycle of transmission as you go from the host and the disease agent within that host through the vector to the next victim. And impacting the gun is one area where you can impact it, but you could also work at it at other places, right? When you think about it, right, what do the police do to protect themselves from firearm violence? It's not necessarily all on the gun. They also wear Kevlar, right? They wear bulletproof vests, and that's sort of increasing, your host defenses. So if you're looking at it in terms of that sense, that's how we go about things. It's hitting every single place on that cycle of violence or cycle of transmission. Those are all different strategies that we could use to impact gun violence.
Great. And then kind of following up on that, do you have any specific or any more specifics on how we can decrease interpersonal gun violence in our communities and perhaps what other countries have done to reduce gun violence?
It's an interesting and very broad question, I would say. I mean, we've seen stuff like making spaces greener, right? Getting rid of like boarded up homes and making them more livable, street lights, stuff like that. That's also non-firearm related interventions that can help reduce interpersonal violence between people. And so I think there are a lot of different multifaceted ways that we can go about doing this. I can't give you a comprehensive list of it at this point in time, but those are just a few examples of what you could do. And I think that it really is beneficial that we can look at it this way, because I think it allows us to partner with people in multiple ways. And I think if we start thinking about and not just gun violence, then we are able to take care of things that way.
I'm just gonna put a question in that I saw in the chat. Someone asked, what inspired you to write your book?
I would say I didn't want to do it at first. My colleague, Seema Yasmin, whose name you'll see way down there, she kind of encouraged me to do it. She had already written a book, and at first I told her no, that's crazy. But then she kind of kept talking to me about it and eventually kind of explained why, with sort of my public health background and sort of the focus that I put on things with the whole "this is our lane" viral hashtag after the NRA thing, that I could do it. And I happen to be a person that likes to write, and so I just think naturally it kind of took off. We put the pitch together, Hopkins Press picked it up, and 5 years later there's a book. So not a thing that I ever expected to do, but something that happened.
I will say I remember in 2018 the "This is our lane" hashtag trending because I was very active on Twitter at the time. I'm sure you can imagine. So it's really interesting to see one of the people behind it. That being said, thank you so much for sharing your experience, Dr. Dark. We are both honored to have you share your time here tonight. I'm not sure if there's any more questions in the chat, but before people leave this event, I'd like to ask everyone to consider supporting SAFE with a donation. We're going to throw a donation link in the chat and hope that you were inspired enough this evening to consider helping out in this way. Medical students, I know as a medical student, it's kind of tough to swing by, but if you consider setting up a recurring donation of $5 a month, a network of medical students across the country can do so much good. And everyone else, like, don't be afraid to do it now if you're inspired to act. There's also a donation link on the SAFE website as well.
And for those who are with us tonight who may have more financial resources, help us grow the SAFE 1000. You can see what that's all about on the thanks to our donors link in the chat.
We also hope that you will order Dr. Dark's book directly from the publisher or also at your local bookstore. The link for that will also be in the chat. Yeah, this is really difficult work and it doesn't feel like something we should have to do. It feels like we shouldn't have to write books on gun violence or give money, especially because we're advocating for patients and families every day. And we shouldn't have to lose patients on the operating table or to suicide or in the community. But we do want to thank you all for being here tonight and you too, Dr. Dark, thank you for being here and for all the time you took to write Under the Gun.
Thank you all for having me, and thanks for all the work you're doing. Good luck at GW.
Thank you. Have a great rest of your week, everyone, and we look forward to staying in touch with you all at Scrubs addressing the firearm epidemic. Stay safe.